Hello, everyone, and welcome to the first edition of the Schreiber Times podcast. We want to take a moment to acknowledge these hard times and send our best wishes to everyone in the Port Washington community. We hope that everyone is safe, healthy, and doing well. For this edition, we'll be speaking with Dr. David Hirschberg. This Port Washington resident, Dr. David Hirschberg, works at Northwell as the Department of Medicine's Executive Vice Chair for Clinical Operations and is an infectious disease specialist. Welcome to the first podcast. We're so grateful that you've taken time out of your busy schedule to speak with us.
Happy to be with you.
First, I want to ask, how are you doing? I'm sure everyone at the hospital is working extremely hard right now. What is morale like amongst you and your colleagues?
So things actually at the hospital are pretty good, and the morale is excellent. People have really been working incredibly hard. They've been really taking care of each other and looking out for each other. And there's really been this enthusiasm to try to be involved as much as possible. And people are doing different tasks in the hospital that they may not have ever done before. It's really everybody is kind of pulling in the direction to take care of patients and take care of each other in spite of all of the uncertainty and anxiety that goes along with it.
That's great. I'm really happy to hear that. So is part of your role in the hospital to, like, would you say, keep, organize what everyone's doing now and, give people new roles and things like that, or not as much?
Yeah, I mean, that is part of what I do. I'm working as part of a team to try to have doctors fill roles that they may not have filled previously, but also as an infectious disease specialist, I'm seeing patients in the hospital, and I'm also trying to help to come up with protocols, working with other people in the hospital to try to create a safe atmosphere, both for patients and staff, and to effectively take care of the patients that are with us.
So getting to more more specifically about the virus, I think that a lot of what we're seeing is that there's a lot of information out there, a lot of misinformation out there. So in a way that's kind of, I guess, easier to understand, like, how exactly did this start? Is that even known how exactly it started? How did it spread so far to be, start all the way across the world and come here? And at what point were you kind of like, wow, like, this is going to be really bad?
We do know where it started. We know that it started in Wuhan, in China, and was linked to a seafood and animal market there. And then it really started to grow and spiral within China, and then spread throughout China.
Right.
And it really then from there started to spread throughout Asia into South Korea and Japan, and then from there to Europe. And I think once it got to Europe, there was really the feeling that this was going to be very serious, and had the potential to really spread everywhere in the world and become a true pandemic, which it now has. I think, it's the coronavirus, and coronaviruses have been around for quite some time. We here in our country have coronaviruses that cause infections, usually the common cold, and cause that each year, but usually it's fairly mild. What's unique about this virus is that it's not a virus that anybody has ever been exposed to, so there's no pre-existing immunity to it, and that's the reason that it has had the ability to spread so widely, is because there's just no pre-existing immunity.
So when it hit Europe, did you think, oh, like, this is, what's happening now, where everyone's social distancing and, only essential businesses are staying open? Like, you saw that was how it was going to be in the US once it was in Europe, or not quite?
Yeah, I think that that was the expectation, is that this is going to be something that in Europe, as they started to experience that through the early part of this year, January and February, feeling was that it was only going to be a matter of time before we started to experience it here. But I think that there is so much that we still don't know about the virus, and it feels like every day, and sometimes it feels like every hour, there's something new that we learn and some new incredible challenge that we are faced with. I think also we may not have truly appreciated or thought that it would be quite as bad here as it has become. And I think as bad as things were in Italy and in northern parts of Italy, I think there just was really the hope that we would not experience it quite as badly. The original SARS virus that appeared about 20 years ago sort of disappeared on its own. And it's really not clear why that happened. And I think that it really was just not clear to everybody that we would experience this to the same degree that we are right now, though I think there was the expectation that we would be all affected to some degree.
Mm-hmm. All right. Thanks, Dr. Hirschberg. Thanks again for joining us. So obviously the shortage of masks and other PPE equipment in hospitals in New York and around the country has become a huge issue. I know in Italy, the lack of these protective items amongst medical professionals led to a huge rate of infection among these medical professionals, even led to a shortage of doctors and nurses. So is the infection of medical staff also becoming a problem here in New York due to the lack of PPE equipment?
It is. I think, within our own health system, everybody has the PPEs that they need. So certainly in the hospitals that I work in and in the system that we have, anybody who is seeing a patient has the N95 type of respirator mask and face shields and gowns and gloves, and they are widely available to anyone that is seeing patients. But there certainly is the concern and risk about staff members within the hospital becoming infected. And there have been several doctors and nurses and other staff that have been infected. Whether they became infected in the hospital or they became infected in the community is hard to know. But certainly being in the hospital, which is, its own hotspot of infection, is a likely risk factor for many of those people.
100%. That's very interesting. So another thing this virus has caused is the cancellation of countless events, obviously, from professional sports games to concerts and festivals. However, some organizations recently, like the MLB and the UFC, are looking to resume sporting events in secure locations while utilizing extra caution. The MLB recently released its detailed plan to begin the season as early as next month, with all games taking place within Phoenix, Arizona, and the surrounding areas. And also, UFC CEO Dana White is in serious discussions of renting out a private island to host UFC 248, dubbed the Fight Island. So given the current state of the country and the rapid spread of the virus, is it safe for these groups to move forward with these events as long as they take extra caution?
So I think that the question of when we can return to normal activity or some semblance of normal activity is going to be something that we're probably going to hear a lot more about. Yesterday, the CDC actually put out a report and recommendations as to how essential workers can start to go back to work and some of the precautions that they need to take. And I think we're going to gradually hear more about that as time goes on. I think it's still premature to think about us, and certainly in our own local community, being able to return to normalcy because especially in the New York area, and in the area that we live in Queens, Nassau County, and Brooklyn, we are the epicenter of this infection. So the notion that we could abandon the social distancing that we've all adopted over the last several weeks, that just seems like a very bad idea at this point. Eventually, there probably are going to be parts of the country that are less affected, and there probably will gradually be able to be, I guess, a slow return to somewhat of a normal type of existence. But I think that it has to really be very carefully thought out. And there has to be some degree of understanding of whether people are actually have recently been exposed, what the potential risks are, and certainly limiting large gatherings is something that I think is going to be in existence for a long time. So I guess that's a lot that I just put out there, but my point right now is I think that it's just overall too early to act upon stopping the social distancing. I don't think it's too early to think about strategies that could be put into place so that we can move toward that direction, but to take action and actually stop social distancing right now seems like something that the country's just not ready for.
And obviously, we've seen some public officials discuss like deadline dates for opening back the country. We know Trump a few weeks ago announced Easter as a target date for reopening the country. So what you're saying is that these hard deadline dates are unrealistic, and that a more gradual return to normalcy is far more likely.
Yeah, I think that I understand why targets are set. I think the public wants to have an idea of how they can think about things and plan. But I think that we have to monitor the data that is being given to us. And if we're still seeing a high prevalence of infection in certain communities, we have to be very smart about that. And I would say that that's not the right time to reverse the gains that we've really made. And I think that there really is evidence that the social distancing that we have all been practicing has started to make a difference within our own hospital system. We really are starting to see a plateau of new hospitalizations, at least when it's looked at from a daily basis. And I think our hospital system is not the only hospital system that's experiencing that. So I think that the gains are real. And this is more than just a mild flu. I mean, I think that the significant illness that people experience and the real risk of death is just tremendous. And I think we need to have a lot of perspective on that. But also, I think people are struggling and suffering from an economic standpoint. So there is the recognition that at some point things have to start opening again. So as I say, I think that a strategy to think about the right time to do that is important, but I just don't think that we're at that stage just yet.
Awesome. Thank you.
Hi, thanks again for joining us. So I guess you covered a lot of this with Noah's last question, but everyone's obviously itching to return to their normal lives. And you've definitely explained that it's going to be a gradual change. But from a medical standpoint, how are we eventually going to be able to return to normal without putting people at risk of getting the virus again?
Right. And that's a great question. I think if we had no other tools beyond what we have right now, then I think that we would have to see a significant drop in the number of cases that our community has before we could think about returning to school, returning to work, and just kind of getting on with the things that we would typically be doing this time of year. I would envision that in the near future, testing is going to be more widely available for people. And not only will it be more widely available, but the tests can come back more quickly. Also, there's going to be blood tests to be able to show if somebody has become infected recently, because many people have been infected but did not have any symptoms associated with that infection. So the blood tests, while they wouldn't diagnose somebody currently having the infection, they could point out if somebody recently had the infection, and that would predict that they could probably return and be in the community with at least a lesser degree of becoming infected again. We're not sure if a previous infection prevents subsequent infection, though we think most likely it does. I think that those tools of widespread testing will likely be factored into decision-making as to who it is safe to have back at work. But to operationalize that whole process is something that really has to be built and could be complicated. But that may be all built into the strategy to eventually bring people back into the workforce and bring them back to school.
Now, some other countries like China, new coronavirus cases were on the decline for a while and then they spiked back up. Would you say that there's a high likelihood that that happens here, or do you think that we can prevent that?
I think it's hard to know. I think there remains so much that we don't know about this virus. For example, we don't know how the warmer weather will affect the virus and whether we'll see a significant decline. I think part of that is that we don't know exactly the various ways in which the virus predictably spreads. We believe very much that it spreads by droplets, by large droplets, which would mean that people within around 3 to 6 feet from each other can become infected. But if it spreads by a very, very tiny droplets, that means that those viral particles could spread through the air and actually infect people that are more than just 3 to 6 feet apart. The reason I bring that up is because the warmer weather really affects the degree of spread. And one of the reasons that there's less spread of things like the flu and the common cold in warmer, more humid weather is that it really suppresses the ability of droplets to be the means in which the virus transfers. We don't have all of the answers as to how this particular virus causes infection. And so it is possible that the warmer weather will suppress things, but we don't really know. I think we'll know soon enough. So there is the thought that we may see a lower number of cases, and then there's the potential for it to reemerge later in the fall, but we'll see. And hopefully, the thing that will change all of this is once a vaccine becomes available. And then if we have a reliable vaccine and you can provide the vaccine to enough people, which can make enough of our population immune, that really would be the true shutoff valve for new infections in our community and in our country as a whole.
Thank you. And what do you think? Would you say that there's a good chance that we see another virus like this develop in the future? And what can we do next time, if there is a next time, to identify and prevent a virus from spreading in this same manner?
So I guess I really hope not, because this has been just an awful, awful thing for everybody. But, if we look back to 2009 with the H1N1 pandemic, I mean, we saw a virus really spread throughout the world, and a virus that was not something that we had ever experienced previously. Fortunately, that virus was not nearly as contagious nor as deadly as the current coronavirus. But I think there's a tremendous number of lessons learned from this experience that we're going through. And I would at least hope that the next time there's a concern about this, that we all will act very quickly in a more synchronized way, and hopefully be able to be more proactive and be able to deal with it because of the lessons that we've learned through our current experience.
Great, thank you.
You mentioned the vaccine being like the overarching way to kind of end all of this. Do you have any idea? I mean, if you had to guess what a timeline would be for a vaccine, like what that looks like, or?
Yeah, so there are clinical trials that are going on right now. There's several pharmaceutical companies that have started enrolling people in clinical trials. So these are uninfected individuals. But getting a vaccine from the laboratory out into widespread public use takes a long time, because it first has to go through a safety process and be sure that it's not causing more harm than good. It has to go through a process to be sure that significant immunity is being generated. And then once it's felt to be both safe and effective, then the FDA would have to approve it, and then it gets put out there and deployed so that we can experience it on a large scale. I think that the expectation is that the earliest we would be able to have this is probably at the end of this year or early 2021. But, certainly possible that something wonderful happens and we have it earlier than that. But it's also possible that there are some, bumps along the road, either with safety or effectiveness. And, it might be further into 2021. I think we just don't know, but almost certainly not in the next 3 to 6 months.
Mm-hmm. So it'd be definitely after the time where you would see, like, if the warm weather was going to have like a positive impact on this, then it would be far after that.
I think that that's the most likely thing. It's so hard to predict, but I think that, the hope is that at the end of this year at the earliest, but probably not much before that.
Mm-hmm. So before we end things, is there anything that you would like to add on what, the next few weeks might look like, or, just virus prevention in general, like the most effective thing that you've seen?
Yeah, so I guess I think at this point in our communities, my hope is that we are about at the apex and plateau of infections. And my hope is that we're going to gradually over the next few weeks see smaller numbers, and that will be great, and that will give a tremendous relief to the hospital and all the people that are working so incredibly hard to take care of patients there. So that's something that I'm looking forward to. I'm also very hopeful that all of the great work with social distancing remains during that time, and that we don't let up with that. And I think that our hospital is very different now than it was a month ago, in the sense that there's been a cancellation of surgeries and things that people really need. And at this point, we're going to start to gradually have to reintroduce those types of things into our healthcare system. And so our hospitals are going to remain crowded for quite some time, because we're going to have to figure out how to start to take care of people that need to have surgical procedures and other types of treatments that they just haven't been able to get because this crisis has essentially taken over the hospital system.
Right. Well, thank you very much. We really appreciate this and all your time.
My pleasure.
Thank you.
Thank you for having me.
Thank you again for your time. And I think I speak for the entire Schreiber Times staff and Port Washington community as a whole when I say thank you for your work on the front lines battling this virus. You and your colleagues are truly incredible. Keep up the good work and please stay safe.
Thank you, Noah.